Hi Anna, this is Jim. Just replying to your video. I appreciate that you talked about how the counselors were asking open-ended questions to learn more about client history. Also, how they talked about or how they reflected on feeling of the client in a way to validate their feelings. And in your video you mentioned that the first counselor was revisiting goals, which I think is very important in the treatment for a client. So to answer your question, if I think it may be distracting to nod or say too much, I think a good practice would be to use different words of confirmation, like yeah, sure, or uh-huh. And using just varying degrees of it. Also, your last question was asking about good indicators of how to move from assessment to treatment. I think on page 254 of the reading in chapter 8, it talked about positive expectations and statements that validate hope. It says that we have already conquered two major hurdles. I think this is the counselor to the counselee, that by admitting to yourself that you have a problem seeking help, which is not easy to do. And then I guess you can address, do you feel that we can move on, or is there something you still would like to talk about? Yeah, thanks.